It's another Thursday, and ladies and gentlemen, welcome to Body Garage, the art of well-being. Now, there are close to 16 million women and girls who are 15 years and above, and these women are said to be at risk of cervical cancer. In Kenya, about 5,000 women every year are found to have cervical cancer, and about 3,000 of those die from the same. So we are here today to discuss about cervical cancer, and October being about awareness of cancers. And we have the pleasure to have a specialist who takes care of patients in a wide range of cancers. My name is Dr. Chepsi, I'm your host, and my guest today is Dr. Catherine. Karibu sana daktari.
Shukran.
Yes.
And thanks for having me.
Thank you.
Yeah.
Yes. We are honored to have you. We understand you have a wide range of experience taking care of different cancers and taking care of different range of patients, and you have many years of experience as an oncologist. So today we want to hear from you about what you have to say to the people and educate the people about cervical cancer. But before we go into that, just introduce yourself to the people so that we can get to know you more.
Thank you so much. I'm Dr. Catherine Nyongesa Wata. I am a clinical stroke radiation oncologist. In simple terms, I'm a cancer specialist dealing with the administration of chemotherapy, radiotherapy for cancer patients.
Yes.
Yes. Mm-hmm. I am a woman of wearing many hats. So apart from being a doctor, I am a wife, I am a mother, I am an entrepreneur, a business lady, a lecturer. So I wear so many, or I partake many roles, and I thank God for the opportunity He has given me in this world. And something more special is just taking care of the cancer patients and making a difference in the society.
How would you say that, how different is it when you're taking care of cancer patients as opposed to the other types of patients?
Cancer, I think, is a life-changing disease. Once one has that diagnosis, it really turns your life upside down, and many cancer patients come with their lives having been impacted. And as a cancer patient, they also face a lot of obstacles or barriers during their treatment journey. For example, it comes with financial challenges, there are physical challenges. Where do I go for treatment, for example? And also it comes up with the challenges of knowledge. There's a knowledge gap. They are not aware of the diagnosis, what is expected of the treatment, what are the possible outcomes, what are the treatment options. So all those things, they run into the mind of that patient at that point in time, and bearing in mind that they also have their own, maybe it is a child of someone, it is a daughter of someone, a son of somebody, a wife, a husband, a grandmother, grandfather. So all those things have an impact on their journey, and even just the general health of the patient. So it is not an easy disease. It is not a one-time treatment disease. It is a process.
It's a process.
Yeah.
All right. So that's general. Now, today we are talking about the cervical cancer, which it's a cancer that is found in women exclusively, right? Now, just to start us off, in simple words, how would you describe cervical cancer to be, like, for the people to understand what this actually is? So
it is a disease which affects people with the cervix, so it means women only. And the cervix is the lower part of the womb or the uterus, and that part, from studies, it is shown that over 99% of the cervical cancer is caused by human papilloma virus and persistent infection by this virus. So this virus, you are acquire it through sexual intercourse, and then it stays in the cervix for many, many years and starts turning or changing the cervix to become cancerous, and due to the multiplication of cells, and they multiply without control, and they now start causing some symptoms or effects on the woman who is afflicted by the cancer.
So you said the main culprit that leads to development of cervical cancer is the virus, the HPV virus, right? As we commonly know it. And you say it takes many years. Approximately how long from the first time maybe this person gets in contact with the virus to the actual development of the cancer?
Research shows that it takes 10, 15 to 20 years. And sometimes it can even take longer. Yeah. So from the time you get, say you start your sexual intercourse at a very young age, like in teenagehood, maybe you're about 13, 14, 15. So you add on another 10 years, you find you may get cervical cancer by the time you're about 25 years. So anytime you start your sexual debut, add on 10 to 15 years, and that is the time it takes to have this persistent virus infection, the HPV, then it turns it to be cancerous. So this long duration or latent period gives us also an opportunity to screen women. Actually, it's one of the diseases that can be screened, detected early, and treated even before they become cancerous. Before it becomes cancerous, it goes through some inflammation or changes, and those changes can be picked up. And once they are picked up, one can be treated and get cured before you get into the cancer stage. But unfortunately, if it is picked in the cancer stage, then still through the screening, you can have early detection, where treatment is very much more possible with very high chances of cure.
All right. We were going to talk about the screening and treatment later. But for now, allow me to ask, who are these women who are at risk, more risk of developing the cervical cancer?
Any woman who is sexually active is at risk. Any woman who has the human papillomavirus infection, and for some reasons the body cannot clear it. Studies have shown that over 8% of the women, they have this virus, but they'll clear it from their body. Their body, the immunity is strong enough, it fights, and they never get cervical cancer. But a few who have the persistent HPV infection are at risk. Also, those women who have never been immunized or vaccinated against HPV are at risk. Women with multiple sexual partners, or if their partners have multiple sexual partners, which means the risk of being reinfected by HPV is higher because of the multiple sexual partners. And not all HPV are cause cervical cancer. We have the very high risk type. We call the high risk type HPV. They are the ones which are shown to cause cervical cancer. Another risk is those with we call them sexually transmitted infections, like chlamydia, for example, puts you at a higher risk. Women who have sexual intercourse at a very young age, it means they catch the virus quite early, and then it starts affecting their cervix. Women who have multiple children or many children, and also use of alcohol, tobacco can put you at risk. And if you have multiple sexual partners without protection, you know, when you use protection like condoms, you get protected against the HPV and even the HIV infection. And also women who have HIV are also at a higher risk of getting cervical cancer, because HIV infection or HIV virus is known to be a cofactor in supporting or accelerating the effects of HPV to cause cervical cancer.
Wow, quite extensive. Now, let me go back to a few that you've mentioned, just for the people who might have concerns. When you say multiple sexual partners, is it multiple at the same time, or it means maybe a woman has had sex with 5 men in the last 1 year, but one after the other.
It doesn't matter.
It doesn't matter.
So long as you have unprotected sex. And the higher the body count, the higher the chances of you getting the high-risk HPV. So we always encourage women to have one partner, I think, and also to be in a monogamous marriage. But when you are in a polygamous marriage, already you are at risk. When your husband has multiple partners out there, you are at risk. In our culture, we rarely see people doing threesome or all those things, but that's still multiple sexual partners. Or at any one point, you have your trusted partner, but we call them mipango za kando. Yeah, that one increases your risk. So it is always encouraged. So I mean, it's not that easy, but we always encourage that the ABC of sexual health: abstain, okay, or if you cannot abstain, use protection, okay, or delay. If you are young, delay all these things, focus on your study. Then when you come of age, then you can now engage, because that time you are ready to have a family.
All right, thank you. Now, we are going to take a break in a few, but before that, very quickly, how do men contribute to development of cervical cancer? Because you said a woman who has a male partner, this male partner having multiple sexual partners can risk this woman to have the HPV and consequential cervical. So how does that happen?
Men have a key role in this, because we know that HPV is sexually transmitted. But you never know when did you ever get this high risk HPV. It could be you got it from a partner long time when you are still young and not the man you are living with. So I always tell women that don't start blaming your husbands, because I've seen many, they come blaming their husbands that now, I have this cervical cancer. I think this man is the one who gave me this virus. It may not be the case. In fact, most of the time, maybe you got this HPV virus long time ago before you met them.
Yeah.
But men have to support their women. When your woman is diagnosed with cervical cancer, you have a role in terms of encouraging her, taking it positively, not judging, because people can be very judgmental. You may actually have had just few sexual partners, but you are just unlucky that one of them had HPV. The way you could have just one person with HIV and it changes your life. Yeah.
All right, thank you so much. We are going to take a break, and when we are back, we will pick up the discussion where we have left, so stay tuned.
The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on your victories, your health, your money, your security, your past, present, and future. We are interested in telling the stories of creativity, hard work, and resilience that you are known for.
That is our job. This is my job. My name is Victor Muyakane, and it's my honor to bring you this news this way every Thursday night on the Home of Untold Stories.
Katika majengo haya, hapa ndipo sheria zinapotungwa na zinapopakuliwa. Nitakuletea viongozi mbalimbali, mirengo mbalimbali, wote kwa pamoja wakipika na kupakua, tutawapa nafasi kuweza kuangazia changamoto na mafanikio ya ugatuzi katika ukumbi wa siasa kila siku ya Jumanne kuanzia saa 1 kamili na kuendelea.
Toka eneo hili la Naivasha kwenye kaunti 032, gatuzi la Nakuru.
Toka kaunti ya Elgeyo Marakwet, kaunti 028.
Nikiripotia runinga ya TV47 kutoka kaunti ya Wajir.
Nikiripotia TV47 kutoka kaunti ya Turukana.
Kwa matukio yote yanayojiri katika kaunti hii 012.
Kutoka kaunti nambari 1, kaunti ya Mombasa.
Nikiripotia TV47 kutoka kaunti ya Lamu.
Nikiripotia TV47 kutoka Kisii kaunti.
Welcome back. You are watching Body Garage, the Art of Wellbeing. I'm your host, Dr. Shepsi, and we are discussing about cervical cancer. We ended our discussion, we were talking about who is at risk of cervical cancer. Right now, as we are back from the break, Daktari is going to talk to us. First, Daktari, so we've talked about the risk factors. Now, how can somebody know that they are at risk of, that they have or they might be developing cervical cancer? In regard to what are the symptoms, what are the things that somebody can start picking up early enough?
Okay, thank you. So cervical cancer in the pre-cancer stage has no symptoms. Once it goes to stage 1, 2, still you may not experience anything. That is why it is very important to have screening.
Yeah.
But some of the commonest symptoms that we see in women with cervical cancer presenting with include pain during intercourse. So when you're having sex with your husband or your boyfriend or your partner, you feel a lot of pain during that time. You may also have spotting. Spotting means there's some slight bleeding. During intercourse or after intercourse, you're not in your periods, but you just see some spots of blood. You can also experience a discharge, can be false smelling discharge, which is abnormal. In normal cases, women have a normal discharge, which is not a worry, but this is a persistent discharge that is concerning to the woman, and you've been treated for other illnesses including yeast and it's still not going away. You may have altered abnormal uterine bleeding. This means you usually have your normal periods, but these are abnormal. For example, you bleed in between periods. You may have prolonged periods or very heavy bleeding, unexplained heavy bleeding, and contact bleeding. You just have sex and you start bleeding. Yeah. Mm-hmm. Another symptom may include incontinence, where you cannot control your urine. Urine just starts leaking. If unattended, you have stool leaking. That is the point we say you have fistulas. So you have vaginal rectal fistula, or you have a rectal vaginal fistula, where feces will leak into the vagina or urine can leak into the vagina.
But that will point most likely to an
advanced stage. Yeah. Other times you have complications with your urine when the kidneys are blocked by the tumor. It blocks the ureters. So you have kidney failure. So then patients will present with signs of kidney failure. That's still in advanced stage. Excessive bleeding can lead to low blood in the body, anemia. So you have signs of anemia. You feel tired, you just feel headache. Things are not just normal. And in advanced cases, the cancer can dislodge from the cervix and spread to the lungs, the liver, the bones, the brain, anywhere. And the symptoms will be now focused in those areas that the cancer has spread to.
Mm-hmm. Wow, great. But what I'm picking is that mostly from the early stages you can't experience any.
Sometimes you can't tell.
You can't experience.
And the cervical cancer is the biggest mimicker. All the symptoms I've said can still occur in non-cancer conditions. Like if you have uterine fibroids, or you have hormonal imbalance, you have genital infection, all those symptoms can occur. So it is good that you get a medical diagnosis, because one cannot just judge you that you're having a discharge, then it's cervical cancer. That is not the case. It needs more intense look and a diagnosis has to be made. Yeah.
Right. Now let's move on to what you alluded before. Is there a prevention to many cancers? We might say that they are not preventable. I mean, if it was to happen, it will happen. But is it possible that we have preventive strategies for cervical cancer?
Yes, there is a small percentage of cervical cancer where the cause is not known and you may not be able to prevent it. But where we know that HPV is the biggest cause, then there are some preventive measures. You can do primary prevention, whereby we immunize young girls, teenagers, before they become sexually active. And currently in the country we have a program where children from age of 9 to 14 are getting free HPV vaccine. In fact, the recommended age for our program is 10 years. So if you have a 10-year-old girl, you take them for the HPV vaccination. Apart from girls only, for now, because we know that cervical cancer is a public health care problem and it's a woman issue. Though when resources allow, boys can also be vaccinated.
So the main target are girls.
Yes.
But also
boys are encouraged. But we know that the biggest problem is now in women. And you know, when you're doing public, when you're doing public campaigns, you also look at the impact. The biggest impact will be in girls, where as they mature, the rates of cervical cancer will be less. Then in secondary...
Before you move on, sorry, Dr. Ali, let's talk about this HPV vaccine a bit more. Because many, you understand, in Kenya, in the Kenyan context, there are cultural issues and there are maybe myths that people have about this vaccine. First of all, how comes there is a vaccine against a cancer? So how does it work that we have a vaccine that supposedly is going to prevent a cancer, which is not common knowledge? And secondly, there are people who say, why are you targeting girls? Myths like you want to make our girls to be barren, like not to have children in future.
So the HPV vaccine, human papilloma vaccine, it is an attenuated virus or a virus that has been weakened, so it does not cause infection in the person who gets it. It is safe. It has been approved by the World Health Organization to be safe, effective in preventing cervical cancer. So what it does, once one is immunized with the vaccine, you build up immunity. It stimulates immunity in your body so that you are armed to fight future infections with HPV. Because so long as you live and you are a woman, sexual intercourse is almost inevitable. Many women will ultimately become sexually active and they will encounter the human papilloma virus. And this virus is very common in our society. Over 80% of people have this virus. So the chances of you getting the HPV infection is very high. And for you to be able to fight it off so that you don't have persistent HPV infection that ultimately turns the cervix to become cancer, now the HPV vaccine offers you that protection. You already mount enough immunity. You encounter this virus, you just kick it out of your body. There are those who kick them out of the body by just your own innate immunity, but the vaccine is supposed to help you boost that immunity. For example, like measles, it works in the same. We immunize our children against measles, so when they encounter measles infection, they have a stronger immunity to fight.
Yeah.
So it's the same with the HPV. So it does not cause our girls to be barren. It is not a family planning method. It has been approved by World Health Organization and is strongly recommended that it should be given. In fact, it is one of the campaign by 2030 by World Health Organization that we should push to immunizing almost 90% of our girls against HPV. We should even push to have screening of women, over 90% of the women screened for cervical cancer, and if possible, all those diagnosed with any HPV related disease can be treated. So it is a treatable condition. So I think and children can get the first vaccine maybe at the age of 9 or 10, and then 6 months later you can go for the second vaccine. We don't recommend it so strongly for older women because they already have probably are sexually active and they have the HPV virus in their body. So in terms of offering protection, this HPV vaccine may not be very effective at that older age. But if you are older and you've been screened and you don't have the HPV virus, you can still go ahead and have the HPV vaccine. In fact, now the age bracket has been extended to about 45 years old.
To still get the vaccine.
You can get the vaccine.
But after the screen is done?
After you've been screened. But for children, it is being offered paid fully by the government. But for older girls, more than 15 years, then and older women, then they have to pay for it themselves. Yeah.
But it's worth it. All right. We'll have talked more about the vaccine, but that's a story for another day because there might be several misconceptions around it that might hinder the uptake. But let's move on. You had also wanted to talk about secondary prevention.
So there we target screening because many women in our community currently never had an opportunity of getting the HPV vaccine. Yeah. So then it is a good population for now screening. You can have the HPV test. You can also have the pap smear test just to check if there are any signs of pre-cancer condition in the cervix. And with that, it can be detected and get treatment. And even if we are still immunizing our girls against HPV, there's room for educating them. So sex education is very key in primary school because we know that the triple threat that is affecting our girls currently is HIV infection, teenage pregnancy, you see? And all those things we have to educate them that you have to take good care of yourself. And even if you have this HPV vaccine, you can get other diseases. So the more reason you need to take care of your health, to take care of your sexuality until you are mature enough to start a family.
Yeah. Oh, wow. Now about the pap smear, at what age should a woman start doing the pap smear and how frequently henceforth?
So pap smear, okay, it depends. So one has to go to the doctor, they will assess you, do you have risk factors, how is the HIV status, but we do various tests. So pap smear we do like for women about 30 years and above. Yeah, but others for the rest of the population we just do HPV testing.
All right. So, okay. So at least 30 years onwards. So I've done my pap smear when I'm 30 years as a woman. Now after that, if I'm found that there is nothing, what is the next time? When is the next time I should repeat?
So once you've been screened and you are found negative, you can wait for another 3 to 5 years. Yeah, before you do another test, unless you are in the high risk group. The high risk group are these women with the multiple sexual partners, or they have HIV. So those ones we encourage, maybe your doctor may recommend more frequent screening. Yeah.
Thank you so much. Now let's go on to the next part. Somebody has come and they've been screened and they have a sign of cervical cancer. Maybe it has been confirmed. How is the patient flow henceforth for somebody who is going to now start this journey about cervical cancer? And we will pick right from our break on that discussion, so stay around, because when we're coming back, we're going to talk about that journey.
The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on your victories, your health, your money, your security, your past, present, and future. We are interested in telling the stories of creativity, hard work, and resilience that you are known for.
That is our job. This is my job. My name is Victor Muyakane, and it's my honor to bring you this news this way every Thursday night on the Home of Untold Stories.
Katika majengo haya, hapa ndipo sheria zinapotungwa na zinapopakuliwa. Nitakuletea viongozi mbalimbali, mirengo mbalimbali, wote kwa pamoja wakipika na kupakua. Tutawapa nafasi kuweza kuangazia changamoto na mafanikio ya ugatuzi katika ukumbi wa siasa, kila siku ya Jumanne kuanzia saa 1 kamili na kuendelea.
Toka eneo hili la Naivasha kwenye kaunti 032, gatuzi la Nakuru.
Kutoka kaunti ya Elgeyo Marakwet, kaunti 028.
Nikiripotia runinga ya TV47 kutoka kaunti ya Wajir.
Nikiripotia TV47 kutoka kaunti ya Turukana.
Kwa matukio yote yanayojiri katika kaunti hii 012.
Kutoka kaunti nambari 1, kaunti ya Mombasa.
Nikiripotia TV47 kutoka kaunti ya Lamu.
Nikiripotia TV47 kutoka Kisii County.
Nikiripotia TV47 kutoka kaunti ya Machakos.
Kutoka kaunti hii ya Trans Nzoia.
Kaunti 038.
Kutoka gatuzi nambari 029, kaunti ya Nandi, chemichemi ya mabingwa.
Nikiripotia TV47 kutoka kaunti ya Kakamega.
Itakuwa nikiripotia runinga ya TV47 kutoka kaunti ya Bungoma.
Jina langu ni Paula Munio.
Willy Dennis Jiru.
Fabian Kibet.
Mimi ni Hashim Jimal.
Mimi ni Kitio Mika Masai.
John Javakiania.
Jina langu ni Abdulaziz Nameka.
Mimi ni Kombo Alfayo.
Jina langu ni Nicholas Mbai.
Isaac Famba.
Mimi ni Wanji Sosti.
Jina langu ni Arnold Adidi.
Jina langu ni Chris Bet.
Jina langu ni Violet Auma.
Na TV47 inapotamba, mimi Sheila Chelangat nitakuwa nikiripotia maswala yanayokuhusu wewe kila kuchao. Every Thursday 7:30 p.m. unapata nafasi kufahamu viongozi mbalimbali kutoka humu nchini, kuanzia wabunge.
Through Changa we could get money to pay our rent, pay our bills.
When I was growing up, water was a problem where I was born and bred. We wake up at 3 to go and look for water.
Magavana
must be ready to be a tough woman and not a woman to be walked over.
Kwa hivyo
but you respect people.
Dari ya mfahamu kiongozi, story na historia, na mi Elizabeth Mutuku.
kwa mirindimo kemkem ya michezo, mahojiano,
Welcome back. You are watching Body Garage and my name is Dr. Chepsi and we are talking about cervical cancer. And we've had a lot already of discussion and now we continue on. Somebody has been found to have cervical cancer. Where do they even begin and how is the journey and what are the treatment options that are available? Yes, Dr. Catherine.
Okay, so cancer diagnosis, especially of the cervix, in terms of the journey, it is a multidisciplinary approach. So we need to involve the gyno-oncologist, the clinical oncologist, the radiation oncologist, the counselors, the palliative care team, the radiologist who do the scans, the pathologist in the lab who may need further testing, and so on. The thing is, we bring a lot of people on the table to support the patient through this journey. Obviously not leaving behind the family and friends and the church or the mosque, depends on your religion. So once the patient is confirmed that yes, it's cancer, a biopsy has been taken. You know, maybe you went through screening, they suspected. Now you have to go through now medical diagnosis. A biopsy is taken to the lab to confirm it is cancer. Once it's confirmed, now we move to the journey of staging. What stage is it? Is it stage 1, 2, 3, 4? So you go through imaging, scans, ultrasound, CT scans, may do x-rays, just to check the rest of the body, how it is. From staging, now we go to treatment. It could be a surgical case where they remove the tumor. It could be radiation combined with chemotherapy. And all those are the different modalities we'll use, including what we call brachytherapy. This is internal radiation that we add on top of the external beam radiotherapy. Then follow up. We will get some complications from the treatment, including narrowing of the vaginal passage because of radiation. So we have to rehabilitate, talk to them. How do they move on from there because of these complications of the treatment? So they are encouraged to do what is called dilatation or dilation. They dilate the birth canal, or if they are in a marriage, then we tell them, okay, from here, now your sexual life has to resume, to keep that passage open for future checkup, so that the doctor can check clearly and see is there recurrence or no recurrence. And at the end of the day, you're still a woman, you still have life to live, so we have to help you transition to going back to your normal life and carrying on with your family duties, your employment duties, and so on.
So what I'm understanding is that the earlier, the lower the stage, like the earlier it is found, the simpler the treatment.
Definitely, and the higher the chances of cure.
The higher the chance of cure.
Always best to early diagnosis, timely treatment is the best way to go. But however, even if the cancer is diagnosed in late stages, there's always hope. One is the treatment can help you cope with your side effects of the cancer, and just see how to maybe manage the pain, manage the bleeding, to improve on the comfort of the patient. And there are still some who've been cured despite the advanced stage.
Actually, that's what I wanted to ask, like from your practice, right? From all over the years, different patients. Is there a patient that you've worked with and right now you can say they have been cancer-free?
Yes, I've worked with many patients in their journey, and really I thank God for them, because their success stories is what keeps us going. We have the Uwezo Cancer Support Group members, where we are like friends. We work with them. They've gone through this cancer journey, and we always post and discuss about their challenges, their success stories. And as we speak, yesterday I posted an old photo that we had taken together, and they said, "Hey doc, we just want to come, we meet and again talk about it, just to encourage us." Yeah, so I've seen many go through this treatment. They have complications, others are okay, but we work together with them. There's one specific one with cervical cancer who stands out. She's called Esther. Yeah, she was diagnosed with stage 4 cervical cancer. That was in some way back, like 2015. And she's okay up to now. As we speak, she's become like a family friend. If I need something, I go to her. She needs something, she comes to me. So it is possible that a person with cancer can get cured and live a healthy life. In fact, for the time she was going through treatment, all she wished for was her girl, the last born daughter, to finish 4th form. And for sure, the girl finished Form 4, got close to 400 marks, now went to college, and now she's working. So you can imagine a mother's wish, and it came to pass, and she's very happy. Yeah.
Any particular story that you remember is like a nightmare? You might not mention the name, but just, yeah.
It's been tough. Some of them, especially the younger women with cervical cancer. The cancers tend to be aggressive. Some are in a lot of pain, The bleeding, I'm cold at night, I'm bleeding. Or the cancer decides just to spread to other parts of the body. So you have to struggle managing the complications of the cancer. Some come with kidneys that have failed, and the cost of treating cancer that is affecting the kidney function is high. Yeah, they tell you we don't have money, because as I told you, we involve other doctors, not just the oncologist. You need a doctor to sort out her kidney issues. Maybe they don't have money for those nephrostomy tubes. These are tubes to drain the urine that is blocked. Some, they don't have enough blood in the body, and you just want somebody to come and donate blood for them, and it is a problem. Others are not even able to raise money to pay for the NHIF card, and for you to use it even, you need to have paid a year in advance. So those are some of the challenges I've come across women going through.
Is it just the physical pain, or there is the mental health part also? How do families handle this?
Some, actually, as I told you, it's multidisciplinary. There's the mental health, palliative care, social work. All those people are involved, and some of the women have been left by the husbands. They say, you must have worked badly, you brought this virus in the home. Some, because of the cancer, you may not be able to be sexually active, so men give up on them, or they break their marriages. So it is not easy. It's not just the physical pain, but there's also the psychological pain that these women go through. Yeah.
All right. Now, how, in your practice, what is the average age that most women that you're finding coming with cervical cancer? At what age on average?
Most are between 35 and 55.
35 and 55. Are we finding younger women also? Are the numbers increasing?
I would say for now we're getting younger women. Those who had their intercourse at a younger age and got this HPV, which persists in their body, we're getting, even in 20s, getting cervical cancer. But there are few, yes. Majority are 30 years and above. But with the HPV vaccine that the government rolled out in the schools, I'm sure this number is going to reduce as we go on there. We'll see cervical cancer in much older women.
That will be a good thing. Now, we're almost coming to the close. I would like us to talk about two things as we come to the end. The first is, how is the landscape of cervical cancer care in Kenya? Just in your experience, where have we come from? Where are we currently? How does the future look like in terms of funding, policy, and the related?
So, in terms of maybe screening, it is one of the diseases that our National Cancer Control Program has put more like, it's in the cancer screening guidelines. So there are policies around it. How do you screen for cervical cancer? Who should be screened? And all those policies are in the public domain. We also have prevention. We have the HPV vaccine that has been rolled out. And as a country, we are also aligning to the World Health Organization about kicking or reducing the rate of cervical cancer by the year 2030. So we are also trying to align to that kind of policy. But women with cervical cancer are still coming in late stage. Breast cancer is the commonest cancer in women in Kenya. But you find cervical cancer comes number 2, but it's the leading cause of death in women. Yeah, so many women are succumbing to cervical cancer, which is a preventable disease. So we still have some ground to cover as a country, so that we get these women in early stages and give them timely treatment. We have a lot of strides that have been covered in terms of accessing treatment centers near them. We have various chemotherapy units in the country. We call them chemotherapy administration centers, about 10 of them. We have 3 national treatment centers for cancer. We have Moi Teaching, Kenyatta University, KNH, so which is a plus. We also have additional radiotherapy centers in the counties, Garissa, Nakuru, Mombasa. So this has been like life-changing for those women who would otherwise have to travel all the way to Nairobi to get this treatment like radiotherapy. We also have, we are training gyne-oncologists as a country. We are training other oncologists like clinical oncologists, radiation and medical oncologists. We are training oncology nurses, clinical officers. So there's a lot that is going on to try and build capacity so that these women get the most help they need in a timely manner.
Sure.
Yeah.
Thank you so much. We've come to the close of our discussion, but before we go off air, where can people find you? If there's somebody that would like to be screened or consult or something, where can they find you?
So for me, myself, I have an office at Kenyatta Hospital, Doctors Plaza, room 35. I also practice at the Texas Cancer Center in Nairobi West. If you are coming from town, you board a matatu number 14 that goes to Madaraka, and you'll find Texas Cancer Center there. You can be screened. And then during Mashujaa Day, we know our president is launching the UHC, which will be in Kericho. So our team is actually on the ground as we speak from Texas Cancer Center, offering free cervical cancer screening, so people can make their way there for the same. I also encourage that people should be proactive and get an insurance cover that can support them in terms of need when they need screening care or they need treatment, because financial barrier has been identified as one of the major inhibitors to the people in Kenya getting timely treatment. Yeah.
All right. Well, thank you so much, Dr. Catherine, for your time. Thank you for sharing your experience and for educating the general public. We've come to the end of our show tonight, and I trust that as our viewer, you have learned something about cervical cancer. And if you missed a great part of this, this is the summary, that cervical cancer is a leading cause of death in women among the cancers. But this is also something that can be prevented more than the other cancers. And so you might take a leap and get vaccinated with the HPV vaccine if you are of that age group, to prevent this menace from continuing onwards. Thank you so much for watching this far. This has been Body Garage, the art of well-being. My name is Dr. Chepsi, and we will see you next Thursday.